This is Kavanaugh at RWCS 2018, talking about rheumatoid arthritis treatments and strategies and approaches. There was an interesting presentation this year about the IMPROVED study. The IMPROVED study was a treat-to-target study that looked at patients who did not go into remission after just methotrexate, randomized them to triple therapy with methotrexate, sulfasalazine, hydroxychloroquine, or to methotrexate plus TNF inhibitor. At the end, it was very successful. Many of the patients achieved remission. Many of those, perhaps half of those who achieved remission, achieved drug-free remission. They did a sub-analysis, which I think was very interesting to clinical practitioners. And that is that it was a treat-to-target strategy, and patients were meant to accelerate therapy if they were not at remission. Some of the patients in low disease activity, but not remission, elected not to accelerate therapy. In an analysis that looked at the differences, you can look at it in several ways. One is that the patients who did accelerate did better than those who did not accelerate and remain in low disease activity, but the differences were quite small and potentially not clinically meaningful. So I think this tells us what we do much in the clinic, and that is that we talk to patients, we involve them in the discussion, certainly as we're accelerating therapy, particularly if it involves adding a new medication or a significant change in that regard. So I think this tells us that maybe for some patients, low disease activity can be acceptable. We always want to get patients to the lowest disease state we can, but we have to work with them to pick the optimal treatment approaches.